These will never pay taxes. They'll never hold a job. They'll never play baseball. They'll never write a poem. They'll never go out on a date. Many of them will never use a toilet unassisted. And we have to recognize we are doing this to our children, and we need to put an end to it.
That was HHS Secretary Robert F. Kennedy Jr. yesterday discussing a new CDC report detailing a rise in autism among children. According to the agency, about 1 in 31 kids were diagnosed with the disorder by their 8th birthday in 2022. That is nearly 5 times the figure in 2000. Joining us now, physician and senior public health contributor for Forbes, Dr. Omer Awan. Thank you very much for coming on the show. Let's start there. Why are we seeing this uptick? Sometimes is better reporting, but is there something else?
Well, the diagnostic criteria for autism has brought in significantly, and this has allowed for many more milder cases of autism to be classified under the umbrella term autism spectrum disorder. And the other thing about this, Mika, is that physicians and pediatricians in particular are doing a much better job screening for autism. So you go to a pediatric office and you'll get good questions about exactly social interactions, learning, and this has allowed many more children to eventually be diagnosed with autism.
So I want to there's a lot of interesting health news to get to here with you, fluoride in the water and this new information about CT scans. So, but let's move to fluoride, which we have in our water for a reason. RFK Jr. says he plans to tell the CDC to stop recommending fluoride in drinking water. Will this happen, and what will be the consequences?
Well, it could absolutely happen because in Utah already they've banned fluoride in drinking water, and this, Mika, could really have devastating consequences for public health and oral health in particular. The American Dental Association has said that fluoride in public water decreases tooth decay and cavities by 25% in both children and adults. And when we consider this, this is really going to be devastating because remember, 70 million Americans lack dental insurance. This is going to cause a huge uptick in cavities, and this may cost the federal government.
Why is he doing it?
He believes that it could be harmful, and certainly at the concentrations that we see, it is not harmful. And decades of research has shown that at the concentration of 0.7 milligrams per liter, we don't see harm. But when it's at higher concentrations, like 2 milligrams, 4 milligrams, it can cause certain adverse effects like tooth discoloration, even bony abnormalities. But the research has shown that that doesn't occur at the concentration that currently exists.
This is in tap water, fluoride, public drinking. A lot of people drink bottled water in plastic bottles. Does that have fluoride in it?
It does, yeah, it does. Certainly, anything that has spring water, anything that comes from a public source has fluoride in it. And this has saved many people, probably yourself and myself, from getting cavities. So it's going to be interesting to see what happens next.
All right. There's also been a study that is highlighting increased cancer risk from CT scans. Tell us what the findings were. And, I mean, where do we go from here? A lot of people really depend on them.
Absolutely. Well, I think the important thing to remember about this study is that it was based on statistical modeling and not real patient outcomes. And what the study did was it showed that, CT scans, which have ballooned significantly, I mean, more than 90 million CT scans are done yearly, can result in 5% of all cancers in America. Now, remember also, CT scans are very important. I mean, they're critical in saving lives and detecting cancers earlier. They're critical in, decreasing hospital stays for people that are in the hospital. And even, they prevent, invasive procedures from happening, and that has risks in itself.
Yeah.
But with that said, there is a harm from radiation from CT scans. People, the more CT scans you have, the more radiation you're going to cumulatively get. And then you can also have an increased risk of having cancer in the future.
We got to go, but on a scale of 1 to 10, RFK as HHS Secretary has you how concerned, 10 being the highest?
10.
Yeah.
10.
Physician and senior public health contributor for Forbes, Dr. Omer Awan, thank you very much for coming on this morning. Come back. And